Hello and welcome. I'm Luke Gagan and I'm Head of Policy and Research at BASRA, the British Association of Social Workers. Welcome to the BASRA webinar, the remaking of social work and child protection, social work during COVID-19. And with me to discuss this research and the lessons for practice, I'm very pleased to introduce Harry Ferguson. And Harry is Professor of Social Work at the University of Birmingham. He qualified as a social worker in 1987 and has taught, researched and published widely in the areas of social work and child protection, domestic abuse, fatherhood and social work theory. In recent years, his research has been around developing ethnographic, which is the technical term for fly-on-the-wall type research, or approaches to getting as close to social work practice as possible by observing encounters between practitioners and service users. I'm also delighted to welcome Laura Kelly. Laura is a research fellow on child protection and social distancing project. Her background is that she's a sociologist with experience of researching work with children and young people in a wide variety of settings. She's interested in how practitioners navigate working in fields where there is rapid change, as well as the experience of those accessing those services. Do send your questions to the questions box. We won't answer all of them immediately. You may be anticipating a point that Harry or Laura is about to make. We've also got a handouts box and we encourage you to visit that before the end of the webinar and download those resources. This is only my second time in doing a webinar, so if it goes wrong, feel free to blame me, but I'm made much more confident that I've got two colleagues behind the scenes, Steph and Jane, who are going to make sure things run smoothly. So big thanks to them in advance. I'm now going to hand over to Harry and Laura, and then after that we're going to take some questions. Harry, Laura, over to you.
Now I'm unmuted, so you can hear me. What a great start in this weird time we're living through of technological events. Thanks ever so much, Luke, for that kind introduction, and thank you and the rest of the BASRA team for all your hard work in putting on this event. Thank you for the invitation and for being such a useful and helpful collaborator, project partner on this this project that we're going to be talking about today. Thanks to everyone out there in social work who've given up an hour of your valuable time. We know how busy you are, and we hope that it'll be worthwhile for you and you'll get something useful out of this webinar. So if you just go to the next slide, please, Steph. We're a research team that's Laura, myself, and just one other person, Professor Sarah Pink, who is an anthropologist from Monash University in Melbourne. We're going to be talking about a research project which we've been doing since April. So we started doing the research just before the pandemic, or just after the pandemic began, and it's essentially into the impact of COVID-19 on social work and child protection. It's funded by the Economic and Social Research Council, and we're fortunate to have BASRA as a project partner along with research in practice. So it's just myself and Laura today. It's about 11:05 at night in Melbourne, so we've given Sarah the night off. So next slide, please, Steph. What we're going to do today is present to you some emerging findings from this research that we've been doing. The methodology was that we were based in 4 local authorities. We kept them anonymous. The research approach is qualitative and it's longitudinal. And what we mean by longitudinal is that we've been interviewing in the region of 48 practitioners, managers, social workers, family support workers, roughly every month for the last 8 months. And the interviews have been done virtually because we haven't been able to go into the field either because of social distancing. We've been so we've been exploring what people's experience of the pandemic has been, what effect social distancing has been having on their relationships with children and families, on working from home, and so on. We've also tracked a sample of cases over the 8 months and explored, what's happened in relation to the work with the families. What have the outcomes been for the children and parents? And we've also interviewed parents from those selected cases. Next slide, please. What we're going to do today is present just some of the emerging findings. So we stopped gathering the data in December. So it's all very recent, but we have been, trying to keep a careful watch or do some analysis of, what's been coming up over the 8 months of the data collection. We've had a remarkable response from the social workers who've been involved in the study. They've made themselves available. It's been incredible. So we're incredibly grateful to them for fitting us into their incredibly busy working schedules. So what we're going to be doing today is just essentially looking at what effect has social distancing had. Social distancing is at the core of in many respects of what this pandemic is all about, trying to keep people apart, if you like. And this is a practice, isn't it? Child protection social work is a practice that traditionally involves getting close to people, having relationships, what I call intimate practice in social work. So what are the effects? So we're going to start with what is probably the most important thing of all in relation to COVID-19, and that is the risk that it represents in terms of infection. So what we have found consistently from the beginning is that social workers have chosen to act with selflessness and integrity. And there's a couple of quotes there on the slide which exemplify what we're talking about here. I suppose for me, it is balancing the risk of COVID-19 against the risk of abuse and neglect and the impact of that on the kids. That risk for me personally doesn't outweigh how I would then feel should something go wrong within that family. And the second worker saying, the risk of me not being able to do my job as I want and trying to build that relationship, especially with that family, that is a bigger risk for me to take over the virus, if that makes sense. Yes, that is more important to me than the potential risk of me catching it. So here we have social workers and family support workers consistently saying that their professional values, to keep children safe, are driving their desire, to go into homes, for instance, when, everybody else wasn't doing that, including a lot of professionals. So a real commitment to get close to children and families, a real selflessness and integrity. Next slide, please. Some of the narrative that we have has suggested that practitioners are sort of presenting themselves as making a choice about whether to do this, about whether to get close to children, even under these risky circumstances. But we want to suggest that this isn't just about individual practitioner choice. There are issues of accountability here at an organizational level and leadership there are systemic processes going on. So in our 4 research sites, which are all in different parts of England, we found, that there are some different cultures of risk taking going on. So in some areas, more home visits, for instance, are being done than in others. And, there are a range of factors that we can, use to explain this. But let's just give one example, and that is the provision of adequate information technology. A decent smartphone. In one of the localities, the workers did not have smartphones that were smart enough to download WhatsApp, for instance. And WhatsApp is the kind of platform of choice for many, many families. So in order to do digital home visits, for instance, in many cases, they needed WhatsApp. So they couldn't do them. So they were sort of pushed, if you like, systemically pushed to take more risks by doing home visits because of that absence of technology. There was a very interesting blog written by Professor Mark Philp early on in the pandemic, where he asks, quote, "What does the principle of selflessness ask of social care workers, and what is it reasonable to ask of public servants?" End quote. That's a question that has really been on our minds throughout this pandemic. And we don't think that it's been debated enough, both within social work and within society. The window cleaner has just started to clean my windows. I got a terrible fright there. I thought, who's trying to break into my house? I'm at home here in the bedroom, like I'm sure many of you are. And so that was very distracting. So the need for a debate about, how far is it acceptable to accept practitioners like yourselves to go in taking risks, and what are the responsibilities of your managers and your leaders in making sure that you stay safe at the same time as being mindful of what's needed for protecting children. And part of this has to be the provision of consistent evidence-based policies and resources. So PPE, personal protective equipment, has been a big part of the sort of story that we've been hearing about over the last 8 months. And there's never been, there's been absences, there's been a lack of PPE in some instances, but now it's more available. But what we have found is that, policies haven't been clear enough on things like face masks. And there's been a lot of variety in how whatever policies are there, whatever guidance is there, how it's being interpreted, even sometimes within the same local authority. So a need for consistent evidence-based policy and resources is crucial. Next slide, please. All of you don't need us to tell you about how disrupted your working lives have become because of the requirement to work from home. And my guess would be that that's where most of you are now because of this third lockdown that we're in at the moment. So just so that we kind of go through it and put it on the agenda here, the sorts of, implications of this that we've been hearing about is, the loss of the kind of informal peer support and the opportunity to process experiences like, difficult home visits, for instance, by not being able to go back to the office, talk to the person at the next desk and so on. That's really missed. The loss of just like sociality, of being able to be sociable in all sorts of informal ways, including having nights out together, having a bit of fun, losing yourself through, just going out, and the loss of journeys, and, because movement has been so restricted. I think it's really significant the way that this pandemic and the sort of lockdowns have really helped us to recognize the importance of transitions, like of that journey from the home to the office and from the office back home again, in terms of as thinking spaces and sort of moments and times when you can sort of process what's happened during the day and so on, which is really hard to do when, your office is your bedroom or your living room or whatever it is. You don't have that transition time. An advantage that we've heard a lot about is that, you're not wasting time commuting. We've heard that in some local authority areas that workers have felt under extra stress because inspections or preparation from inspections have still been going on, even though inspections themselves haven't. And so there's a lot of auditing going on, and workers feeling that this is an additional stress that they could do without at the moment, with all the other worries from COVID. Gaps in these sort of forms of support have been, filled creatively through the use of, digital support like WhatsApp groups. And yet we've been, despite all the exhaustion we've been hearing about, which is completely understandable, our data suggests there's huge resilience being, demonstrated by all of you workers, minimal sick leave, for instance. And just one thing to sort of flag up, which might be worth coming back to in the discussion as well, is is the impact of this sort of individualization or sort of privatization of your work, and less opportunities to discuss things in teams, and maybe there's more risk taking going on because of that as well, because you're more fragmented and there isn't as many opportunities to talk openly about the risks as well as the satisfactions of the work. Next slide, please. Okay, so let me move on now to say something about what we've been hearing and learning about outcomes, in terms of, one of the reasons we wanted to take this longitudinal approach where we looked at practice and social practitioners and families' experiences over time was that we wanted to see what the impact of the pandemic was in the longer term, if you like. And there's no doubt about it. This is really obvious now, isn't it? That COVID has made life harder, and it's made life harder, particularly for people for whom life was already hard. People living in poverty, with mental health problems. It's increased mental health problems. It's increased the levels of domestic abuse, really, compelling evidence for that. This has been made more difficult by the absence of many addiction and therapeutic services that many of the families rely on, because they've, stopped doing home visits or retreated online or stopped altogether. So it's clear from our data that some children have been removed and taken into care who probably otherwise would not have been. The pressures in the family and so on have been such that they haven't been able to cope. And there are, lots of human rights issues that I'm sure you're all kind of worry about, in terms of meaningful parental participation in decisions through, virtual courts, the difficulties of family time and it not happening often, or when it does happen, parents being told literally not to hold or touch their children, very, very painful. So all of those issues have been coming up. So next slide, please. We want to focus on, some of the learning in terms of some of the good outcomes that are apparent from our data. And there are several of them. I think Laura would agree that, and Sarah, that despite everything, despite, all the kind of barriers, all the complexities, the addition, and it's, child protection work was complex before March 2020. Well, it's even more complex now. But despite all that, there's been some really good outcomes in the cases that we've tracked, and we think that, and this is where the title of this webinar really comes into its own. The remaking of social work during COVID-19. We think that practice, in some respects, has been remade. In some ways, it's gone on in the same ways that it always has, in terms of being relationship-based. But there's been some new features, and in some respects, we think, there's learning here about what social work actually is, what the practice is, and how it has impact. And let's start with, what we call humane practice. So we've heard a lot from social workers about how they've been providing more material support, such as food, to alleviate food poverty and so on. Many families have told us how appreciated this is, how much they've appreciated their social workers, because of that kind of material support, but also because social workers have kept turning up, yeah, and many other professional groups haven't, yeah. So here's a mother saying, when what the social worker we're calling Sandra, all names have been changed, when Sandra offers to have these WhatsApp sessions one-to-one with my children, I welcome that, and I can say from speaking with them that it has helped. Now they understand more some episodes or some things they have witnessed. That's a father saying that. Next slide, please. I'm not going to read out this quote in the interest of time, but it's another example of a mother in this instance talking about how helpful a social worker was to her. She actually got COVID. She caught COVID-19 herself, this mother, and extremely grateful for the different relational kind of work that was done with her and her children, and the material support. And next slide, please. So reliability is such an important aspect of what good social work is. Turning up even when you're not welcome, persevering, endurance, yeah. It's not just about care, as you will all know, but it's about the use of good authority in social work. And in many of the cases that we've have in our sample, social workers have placed limits on parents, on teenagers, some teenagers who've been, exploited in different ways. And here's a quote from a father talking about, how good the social worker is. He said, "He is really good. I must admit," he says, "I must admit, this was a father who did not want to have anything to do with social work when they began working with the family at the beginning of the pandemic. And by the end of our period of data collection at the end of 2020, this father was telling us about how approachable the social worker was being, how helpful. And this social worker challenged this man to stop drinking, to stop abusing his wife, and to care in a much more, healthy, respectful way for his children. Real, effective, relationship-based practice based on perseverance and reliability." Next slide, please. The next aspect of learning about what social work is that we think has, that the pandemic has helped to illuminate is in relation to what we call intimate relational practice. Social distancing is at the heart of the pandemic. Well, what we think we have found is that touch and closeness are therapeutic practices, and they're central to what social workers do. A lot of the time, social distancing does not happen when there are younger children involved. And workers have tried to keep their distance from children, but many, particularly younger children, don't keep their distance from workers. And what we found is that workers have provided nurture for children when they've requested it, when they've acted it out, when they've, hugged them. Workers haven't, pushed them away. They've provided comforting touch and kind of a therapeutic sort of made these into therapeutic encounters in which touch was really important. And here's a social worker talking about these two children under 5 who came over and smiled at me. I was playing peekaboo with a little boy. He was putting his face on the floor and then jumping up and smiling, but he was quite close to me when I was doing it. I didn't touch. I tried not to touch either of them on Friday, but the visit before, and the little girl had come and put her head on my knee. It is really difficult with the little children because they just don't understand, and you don't want to frighten them because you're there to help them. So this is very typical of the kind of narrative that we've been showing. Social workers taking risks to help children, and the outcome showing that it has been helpful. Next slide, please. And big dilemmas around babies can't approach workers and initiate touch. But the way we would frame the work that's gone on with babies and infants is that although workers haven't been able to physically hold them, they've been able to hold the babies and the parents in mind. And that sort of comment draws some kind of psychosocial theory where a relationship of care is created where the worker communicates to the parents and to the infant through quality attention. that they are holding them emotionally. And that, again, is a therapeutic type of intervention. Next slide, please. And Laura, it's over to you now.
Great. There we are, unmuted. So, great, thanks, Harry. Well, I mean, as Harry said, I mean, we observed that social workers demonstrated considerable resilience over this period. You know, they were also extremely resourceful. You know, we observed learned of various adaptations to practice that enabled social workers to remain close to children and families, despite the requirement to stay physically distanced. And those adaptations had a spatial and a temporal dimension. So in terms of the spatial shift, particularly over the summer period, and where the specific concerns that led to social work involvement allowed, social workers often moved the home visit away from the interior of the home. So where families had access to outside space, visits often took place in gardens. And when they did not, or when social workers wished to speak to a child or other family member individually, they often went on the move, so walking around streets, parks, woods, and so forth. And we learned of a number of examples where this enabled open and trusting conversations and an increased possibility of support. So next slide, please. So this is just one example. This social worker suggested, we're concerned around child sexual exploitation with this young person. And she's part of a group where many have had social workers. And she was very much referring to her friends saying, you know, I've told her this is nothing like what she said having a social worker was like. She always said it was awkward. You know, she was in a room or in school or she was at home. And actually, I found this really easy. And I found talking to you really easy. So we were talking about the differences. And she said she felt that being out in the community, being away from school and home, gave her the privacy that she wanted to talk, while not feeling locked away, not feeling like, you know, when you're in a room, there's only one door, you know, one entrance, one exit. She felt kind of more free in herself to be able, you know, she was very much choosing to walk beside me, choosing to sit on the grass, whereas she wasn't in a room with a shut door. So I think there's something about what that symbolises for her. So some social workers reflected on the importance of car journeys to their pre-pandemic practice, particularly when working with older children. And they saw these walking encounters as offering a similar form of shoulder-to-shoulder communication. So as a team manager told us, sometimes when you're not just sitting and directly asking kids questions, you get so much more. So in addition to this spatial shift, we also observed that even at times where social workers were attempting to visit less, or to keep their visits as short as possible in order to reduce infection risk, that they were overall having more contact with families. And those contacts were spread out both over time, but also across a range of platforms. So a really significant development of a pandemic is the emergence of a hybrid practice, combining telephone calls, video calls, and the use of text messages, images, as well as in-person encounters. And we were told of examples where some social workers were speaking to family members very frequently, you know, sometimes daily or even more often. Next slide, please. So social workers in long-term child protection teams did give us examples of this, but it was perhaps particularly striking in initial assessment teams who found they had more space than normal to work with families as referrals fell during the early period of the pandemic. You know, now that clearly also presented a number of concerns that children at risk were remaining invisible to social care. But for children and families within the system, there was a sense that less pressured workloads meant more positive early encounters with social workers, and that necessary work could sometimes be completed by assessment teams without the need to transfer the case. So as this team manager observes, that she thinks that the circumstances of the pandemic helped her team to see that they could be a little bit more resourceful. So taking kids out on bikes or on socially distanced picnics. And she was saying that in an assessment team, we're so rushed with our assessments that we just sometimes very quickly do direct work with children rather than quality. And she felt that they'd taken this opportunity to do some more quality work, which had been really helpful. You know, so I don't want to paint an overly idyllic picture. We were also told of challenges. Ensuring privacy and confidentiality wasn't always easy outside. and it became obviously more difficult to spend that time outside as the seasons changed and the weather, became less favourable. And importantly, of course, sometimes the concerns that led to social work involvement and also changing guidance and the implications of that for reporting requirements meant it was necessary for social workers to spend time in family homes. Next slide, please. So, these issues and these kinds of concerns are also significant when considering the use of various digital technologies within child protection social work, and indeed social work more broadly. Within the first period of lockdown, it was common for some in-person home visits to be replaced with what were often called virtual visits, using video calling platforms like Skype, Zoom or WhatsApp, and for video conferencing and or audio dial-ins to be used for interprofessional meetings, call groups, case conferences, and so on. Now, we've been really fortunate on the project to have the involvement of Professor Sarah Pink, who has significant expertise in technology design and the role of digital technologies in everyday life. And along with our slides, we've attached a research briefing that she drafted, which I'm summarising very briefly here. So in summary, we found that social workers initially had concerns and anxieties about the increased use of digital technologies, and particularly for home visits. They were concerned about missing the sensory cues on which they normally rely, about not being able to check or see what's beyond the lens. So that was both objects, for example, empty cupboards or overflowing bins, but also people. And, they were particularly concerned that a domestic abuse perpetrator could be sat just out of shot and, beyond their knowledge. They were concerned about concealment more broadly. So, families ignoring calls or ending calls early, turning off their cameras, etc. But they were also concerned about not being able to hug or comfort in the ways that they normally would. So we were told it's a risk balance, and as one social worker said, a video call might be risk-free from COVID, but ultimately these kids are on a child protection plan for a reason, and it's not because we're not worried about what's going on at home. So social workers also had to adapt very quickly when learning to do this digital social work. There was a period of technological adjustment that varied across local authorities, with new applications added to laptops and local authority issued phones. And as Harry noted, one local authority in particular wasn't able to do as much of this work as others because of the kinds of phones they had provided. And digital poverty and exclusion amongst families also became apparent and caused real concern. And there were various rapid attempts to resolve this, including buying technology and data for families. But despite the concerns and anxieties of social workers, there were success stories. So one of my quotes there to the right of my slide is from a social worker working with children with disabilities. And she was saying not only did she think that a video call offered more than a phone call because she could see the child's face and she could see the interaction between him and his mother and so on, but she was also saying that that the video call meant that they didn't go out on a duty visit, which initially they thought they would have to do. It also became apparent that rich communication was possible. Our methodology has meant that we've been able to capture some of the interactions between social workers and parents as they happened. And we can see that people were often ready to speak in depth about the challenges they encountered, about their emotional experiences, and to take the opportunity to seek support from social workers. So Sarah uses the concept of digital intimacy to capture these ways of relating using digital technologies, and to recognise that what they offer might be differently rather than always less valuable than an in-person encounter. So some of our social workers, for example, positively contrasted video calls where participants could speak very frankly, get close to the camera and see facial expressions, with encounters outside where privacy wasn't always possible. So for example, where people were speaking on doorsteps, or indeed encounters inside wearing masks where faces couldn't be fully seen. So I think it's interesting to think about what we mean by a face-to-face visit. And it's important to note too that there wasn't one model of relationship building using digital technologies. We do have examples in the data of relationships being formed before people met in person. We were also told how some groups, and particularly older children and teenagers, might be even more comfortable talking over a video call. But that's not universal even within that age group. And some social workers did feel that their relationships suffered when they weren't able to meet in person. But I think one of the key insights from our data is that digital casework was never divorced from an in-person practice. This is partly because some cases started in person, so before the pandemic, and then went online. So that was the case with the other quoted example there. But also because a lot of in-person visiting continued, particularly for high-risk cases. Social workers anticipated future in-person visits and saw in-person visits on doorstops or even inside as an available tool if concerns escalated. And we do have examples in the data where social workers chose to wear full PPE to enter family homes, even where there was a genuine and known infection risk. But equally, even as in-person visiting largely resumed between the waves of infection, there are examples where social workers continue to use video calls or use video calls alongside in-person visiting for various reasons. And we could say more about that later on if you're interested. We were sometimes told of children and families initiating video calls themselves and also using the WhatsApp messaging function to communicate in slightly different ways than previously. So this included parents sending images or videos to share news of significant events with social workers. But we were also told of teenagers who'd proved hard to engage, being readier to respond to WhatsApp messages than they had been to other attempts at communication. So a significant argument within our research is that it's helpful to acknowledge and explore the benefits and limitations of this hybrid practice on its own terms, rather than simply conceptualizing virtual visits only as a last resort when in-person encounters aren't possible. Next slide, please. So just to reflect a little further on the implications of these findings, social workers were generally very positive about the benefits of online professional meetings in terms of ease, reduction of travelling time, attendance, etc. There were some concerns about including families. Experiences were mixed, but there were some concerns, and some services reported positive experiences of a hybrid approach. For example, case conferences where some people, including family members, attended in person and others dialed in with video or audio. In terms of contact with families, most parents we interviewed were able to adapt to digital support, and some reported positive feedback from their children. And we have accounts within the data from social workers of positive experiences too. Our research suggests that digital technologies could allow social workers to offer more continuous support to families, as well as potentially replacing some visits, and be more available to other professionals as well. But we do need to consider the impact on workloads here. As travelling time increased as in-person visiting resumed, social workers reported pressure from raised expectations about their availability, and perhaps particularly from other professionals. There's thinking too to be done about WhatsApp. There is potential there, but also some risk to consider. And we need to think about the implications of digital exclusion. And more generally, there was a need to, kind of critically reflect and learn from the pandemic innovations, both at this moment where there is renewed interest and perhaps a renewed need to use video calls with families, but also once some of the immediate pressures of this second wave have receded. So next slide, please. So, there are various implications, kind of from this, and I'm not going to talk through each of these points, partly because they mirror some of the points that Harry has already made, and partly, because in the interest of time, we wanted to make sure that we allowed, kind of 20 minutes for discussion. But I think, we would really like to highlight the point, about that there was excellent practice, that happened during this period too. Families felt supported, and certainly we've seen it as part of our role to really sort of draw attention to the visibility of what social workers were doing over this period and have now been doing for a year. A number of social workers, felt underappreciated, I think, at points where, in the long lists of key workers that were being celebrated at various points in the pandemic, social workers rarely appeared. So I think, I'll stop there and, take an opportunity to pause for questions. So thanks very much.
Great, Laura, Harry, thank you very much for that. We have some questions coming in, which I'm going to try and summarize, I think. One question is, Do Laura and Harry have any thoughts about the perceived risks of one-to-one contact in these more flexible ways? They used to do some of that years ago, but people say that it is now a safeguarding risk. Another question that we've had in is not dissimilar to that, in that, and I'm trying to unpack this a bit. I hope I don't misrepresent the questioner. We separate out our personal life from our professional life. So, for example, all the emails to clients go from our work-based account. We wouldn't send it from our home account, and that's partly protection and it's partly accountability, right? That somebody could look at all the emails on the work machine and say, yeah, this is all good, right? So I suppose when you're using app like WhatsApp, which is a one-to-one, it's encrypted. What are the safeguarding implications of that, especially if it's on the social worker's phone rather than on the work phone? And I don't actually know what the balance is between how many social workers now have their own smartphones from work that they can have these facilities on. So perceived risks of one-to-one contact in spatial and temporal ways, and perceived risks in all of these multiple digital ways of interaction, which may not be as open as more traditional forms of interaction to transparency.
Shall I take the first one, Laura? If you take the second. Will I do it? You okay with that? The perceived risks of one-to-one contact, I take that to mean in interactions with service users, children and families. Well, you know, we've got so much data on that. Like, perceived risks are really high because of the risks from this virus. And, you know, as we tried to articulate in the presentation, you know, all the social workers, practitioners, managers, well, certainly practitioners, not as much managers actually. There's an interesting distinction there. Whose perception are we talking about? Some practitioners were more worried than others about the risks of from COVID, but there was a significant number of practitioners who felt that they were taking risks not only to their own well-being and health, but you know, taking the virus home, you know, to their own families. You know, several had elderly parents. They weren't seeing, you know, the human sacrifices, if you like, of doing this kind of work were highly significant for a number of workers. You know, this is where the PPE issue comes in. Some workers wore it a lot, especially the mask and gloves. Some told us about not wearing it very much, some not really at all. And that was, again, usually because you know, they felt the mask got in the way of more authentic communication and helping, you know, with children and with parents. So, you know, some really remarkable risks being taken. My sense is that in the heat of the moment, in the heat of doing the work, there was some minimization of the risks going on, and that's one of the ways that workers coped with doing it. But then when they would emerge from the visits and, you know, talk to us, they would become aware of how risky it is. So, you know, real risk taking going on. Big questions about responsibility of organizations to monitor the risks and support workers in assessing risk to themselves and to families and to their own families really carefully. Okay, Laura.
Okay, so I mean, in terms of WhatsApp, I mean, I think, you know, that this is clearly, you know, a piece of work that needs to be done. I think that social workers, I'm not aware of any social workers that we spoke to using their personal mobile phones to have these kinds of conversations. WhatsApp was on work phones, or it wasn't used, as far as I'm aware. I think the work concerns raised by social workers, you know, and by managers, you know, how is this information shared and stored? You know, how does it appear on the reporting tools that are already used? You know, what happens if images are sent? You know, are they stored with a case file or not? And you know, I think certainly during the period of the pandemic, some organisations were already beginning to try and get a handle on this. I mean, there was an information request sent by one of our services to social workers that we were interviewing, asking them how they were using WhatsApp, and it was clearly an attempt to develop a policy. And I think some of our organisations do have policies around WhatsApp use. Again, this varies between organisations. I know that certainly in a late interview, I asked another worker some of these questions. You know, what was she doing about it? And she didn't know and was going to go back to her managers to ask. And, you know, whether that was at the absence of an organisational policy, I'd need to, you know, go back and check rather than just that individual worker. I think workers, you know, raise concerns too about things, you know, like when you add WhatsApp to a mobile phone, or, you know, you get the WhatsApp profiles of everyone who's stored on your phone. So they were able to see, for example, family members' profiles, which would often include, for example, photographs of children. You know, there's an opportunity to write a personalised message, you know, and so they'd be seeing something that was, you know, never developed for them. It was developed for the friends and family of that person. So, you know, they felt that felt quite intrusive. You know, equally WhatsApp, if you know, depending on how you have your settings set up, you know, it can show whether or not a message has been received, you know, and whether it's been read. And social workers felt that was, you know, both a very useful tool, you know, but potentially also, you know, was controlling in a different way, in an unplanned way. So I think there are a number of things that need to be considered about this in order to maximise, you know, the benefits of this tool and minimise the potential risks. And we certainly hope to be able to contribute to some of that work with the findings from our research.
Right, we've had an absolute flood of questions and we've got 12 minutes to go. So I'm going to give you the questions and rapid response on these ones. Did the use of technology intrude into non-work times? And to what extent that sort of fitted in with, you know, reliability, turning up and just feeling exhausted, really. Quick comment on that one.
Yeah, it intruded enormously. The boundaries between home and work are, you know, were incredibly hard to navigate. In all kinds of ways. We've got, you know, lots of accounts from social workers about, you know, doing virtual home visits, engaging directly with service users online, and, you know, service users being able to see into their homes and asked to see their children, asked to see their pets, asked to have tours of their homes. So, like, you know, it's kind of fascinating, but I mean, it's and, you know, the sort of emotional labor that workers have had to engage in has increased dramatically because of trying to sort of figure out, you know, what is an ethical professional boundary here, you know, because, you know, traditionally, like before last March, service users did not see into my house. You know, now they do. You know, now they can see my picture on WhatsApp or whatever it is. Huge intrusion into the private domain in ways that just didn't happen before. And, you know, I think, you know, there's lots more we could say, and we are going to say, we've covered a bit of this today, but, you know, lots more to be said about how these, in some ways, these boundaries, and this remaking of the boundaries are really helpful in terms of relationship building and equalizing things. But there's real dangers and risks for workers as well in terms of, you know, maintaining respectful boundary for themselves and their private life.
Next question. What evidence was there of social workers being or feeling supported by their managers to manage risks around visits?
Laura,
you speak on that, I think.
you want me to talk on that one?
Yeah, I think so, yeah.
Well, we were lucky enough to have in our sample several team managers, fewer managers above, service managers or whatever. But so we were able to learn a lot about the challenges for team managers as well, and we're absolutely clear that team managers have worked incredibly hard, during this pandemic. And the quick answer is there's a lot of evidence, Luke, that team managers have worked incredibly sensitively and mindfully to try and compensate for the loss of traditional ways of supporting colleagues by not being there in person. So, using, obviously having meetings on Microsoft Teams or Zoom or whatever, having to phone workers, speak to them much more, with the loss of informal kind of support in the office, we've heard lots and lots and lots of examples of how team managers would make real efforts to contact their workers, to check in with them, make sure they're okay, be very aware of when they were doing a difficult visit. I think there's also an issue, though, about whether senior managers have expected too much of social workers and allowed them to take too many risks, because what's on their agenda is Ofsted and being inspected, and so they've got some organizational kind of defenses that they're really keen on maintaining. So I think on balance we would say that systemically social workers have been pushed into taking probably too many risks sometimes, and that the team managers were the kind of vegetarian or meat in that sandwich, and in a very difficult position at times.
Quite a technical question next. How do you balance a hybrid approach when there are clear guidance from the management on how family should be visited based on priority listing? For example, virtual only visits for children in need cases.
I think that's some of the implications I think that we've been trying to sort of pull out here. I think that a lot of services in the immediate response to the pandemic sorted through their cases, RAG rated them in terms of risk, and then they determined how to visit based on those ratings. And that was, at that point in time, obviously, a very efficient and necessary task. But as we're beginning to think, how can we learn from the experiences of, kind of the first lockdown, that, potentially this is an area where those kinds of policies could benefit from a little review. But I think that the benefits of a hybrid approach that combines, kind of video calling when appropriate, the use of text messages when appropriate, and also in-person encounters when appropriate, that has the potential to be, quite, a responsive and effective way of working. And, it's one where social workers are often very well placed to be able to have a view about, what the most appropriate method is to use. So I think, as I say, I think that a very inflexible management policy, this might be an opportunity to reflect on that and decide, whether there is a better way of responding, I think.
And to think creatively, the innovative, practice that Laura sketched out, where, thinking really imaginatively about space and time, and where, is it necessary to go into the house? You know, would a walking interview work in this situation? That kind of thing. So important that there isn't this knee-jerk sort of return to the pre-pandemic norm. We've got to create an imaginative post-pandemic practice here that learns from what happened during it.
We've got other fascinating questions, residential childcare, digital exclusion, but I'm afraid we're fast running out of time. I mean, I think perhaps a key issue is, Laura, Harry, what you've drawn a picture of is social workers being courageous, innovative, putting the needs of others before themselves, you know, working under pressure. And this is what social workers really do, as opposed to what people say they do. So I hope that, and you know, we've got listeners from across the 4 nations of the UK, that this kind of research can inform work. For example, in England, we've got a review of the child protection, child looked after system, and they do need evidence like this about what social work is, as opposed to all the kind of the myths, really. So I'm afraid that's all we've got time for. 3 minutes to go. 2 final points. Most of you out there are BASRA members. You do get lots of benefits like this with Harry and Laura. If you're not a BASRA member, do think about joining BASRA. There's lots of benefits, not least you find out about all sorts of exciting events like this. All that remains for me to do is to say thank you to Laura and Harry. I found that fascinating, and the resources are in the box, and I think one of them there's a slight technical glitch, but Jane is going to sort that out once the video of this presentation is available. And I think we are allowed to share the video, so if you want to share it with colleagues and teammates who couldn't be here today, please do so. And thank you all for joining us. I think it's been a fascinating hour. Thank you very much, Laura.
Can I just say, Luke, Steph, if you go up to the next slide, the one above, please. Are you still there, Steph?
No, I'm still here.
Yeah. You can see a website link there, and you can see an email. It's for some reason it's only got my email address on it. That's a mistake, but there's also an email address and a Twitter address there as well. So if anybody wants to keep the conversation going beyond today, we really welcome that. That's really what we're here to do: try and inform policy and practice. And big thanks to Luke and the team for everything, and to all of you for your attention and for the great questions, and all the very best out there.
Yeah, thank you. Goodbye.
Bye-bye.